Not every medical concern requires rushing to the emergency department, but some things, they cannot wait. Hello, I'm Dr. Travis Henson, Emergency Medicine Medical Director at St. Bernardine's Dignity Health. I'm here today to talk to you about when is it time to go to the emergency department. Emergency rooms are more capable than urgent care centers. There are things like CAT scans and certain radiographic procedures and other modalities that we have at our fingertips in the emergency department that you won't find in an urgent care. The good thing is that urgent cares are staffed with folks who are able to identify emergencies and what their capabilities are. So they will send you to an emergency department when needed. Life and limb situations should for sure go to an emergency department instead of an urgent care. Crushing chest pain, stroke-like symptoms, these are all things that I would go to an ER instead of an urgent care for. There is no absolute temperature on a fever that requires an emergency room visit. There's other things involved with a fever that would require you to have an emergency room visit. If someone isn't acting correctly, if they're not eating or drinking, they're not able to walk, they're not able to do their daily activities, I would absolutely bring them to the emergency department. If you're not able to control the fever at home, I would bring them to the emergency department. And honestly, I tell folks, if there's anything that has you worried to the point where you feel like you need to visit the emergency department, that's a good time to go. A child with vomiting that just won't stop, a child with abdominal pain that doesn't seem to go away, especially in the lower abdomen, and particularly in younger children, if they're not acting appropriately, if they're not walking or moving or eating or drinking, those are great reasons to go to the ER. The last thing I'd like to share is that the biggest problem with the ER is not coming when you need to. One thing that COVID has shown us is that lots of folks stayed home when they really should have came in. Whenever you have a medical emergency or you think you have a medical emergency, that's what we're trained for. We're trained to spot that, see you, take care of you. And if it's not a medical emergency, we'll let you know.